Listen in as I discuss Trump's 2026 budget proposal, starting with educational and cultural exchanges. So, the admin claims that students from other countries receive technical and high demand training to later leave and take those skills overseas, which in part is true. But on the flip side, American students significantly gain by learning in other settings, and they also acquire new skills when the exchange happens. For Peace program buys out about 2 billion worth of American farm commodities each year and distributes that food to impoverished places like parts of Afghanistan and South Sudan, and it's delivered to 150 countries and feeds billions of people. So, this is a very significant budget cut, and these will have massive negative impacts on food security worldwide. So, if you're not familiar, Federal Work Study is a program that allows students to, usually undergrad students, to work in exchange for their tuition reimbursement. And it's a very effective program. I know people who've had work study, people in my family work study, and the research shows that it is an impactful important program as well. One example from Community College Research Center in 2021 showed that the program can significantly help students pay for school and get valuable work experience at the same time. Calling out one particular industry, specifically at HBCU, a historically black college slash university, is highly problematic. Point blank period. HBCUs, due to smaller endowments and less state support, according to the Thurgood Marshall College Fund, most HBCUs are in heavily congressional Republican areas. And this unfortunately means that HBCUs across the board are already in positions to have to do more with less financial support, other forms of support than PWIs, predominantly white institutions. When the budget states that states can do whatever they want, no need for a federal program, this is really speak for we will allow states to limit eligibility, we'll let them limit funding for X program. And this is a kind of a common thread or pattern throughout this budget proposal, which is expected. But this is the case for the Low Income Home Energy Assistance Program. And according to findings from a Virginia Mercury article last year and a report from Virginia Commonwealth University in 2023, both provided case examples for how when states have significant control over this program, it doesn't necessarily meet some communities' needs because of the disproportionate eligibility and funding that's allotted to it. And that this involved cases particularly from the state of Virginia, which is currently Republican led. What this budget item fails to mention, but I did see this in a NBC News article, is that several minority health initiatives and programs are being gutted and eliminated. That's not spelled out right here specifically. It's loosely identified through the acronym of DEI, and I think one other mention that's kind of linked to another program, but it has been reported that there are programs dedicated to minority health that are getting completely slashed. I'm talking like all the staff from these teams eliminated, which is not necessarily the case for every single center or program through CDC, HHS, other health related agencies. So the list, just a snippet of lists, the either the entire staff or the office for the following: FDA's Office of Minority Health and Health Equity eliminated, HRSA, Health Resource Service Administration, Office of Health Equity eliminated, SAMHSA, deals with mental health administration. The Office of Behavioral Health Equity eliminated, and that's only some of the offices that deal with minority health that have been eliminated. So while this budget item does not specifically state that, it is been reported that those offices have been eliminated and staff have been let go. I'm skipping the NIH because I think that this particular program has been heavily reported on, and so those cuts have been very well, thoroughly discussed in the media. I'm not really sure how these programs would continue to go on nationwide, on a state by state basis, and how they will be staffed if this budget is significantly cut. Because these sorts of teams that do heavy administration and helping to roll out some of these programs, making sure that people are, getting the, I guess, access to the funds that are needed, are usually very understaffed anyway. They're probably currently understaffed. So reducing this budget seems like it will, even though the administration is saying that the actual funding for services, direct services of Medicare and Medicaid won't be, I guess, touched. The staffing does matter very much for these programs, because if they're not well staffed, then it will be harder for, these programs to, I guess, be managed. So I'm not quite sure of how decreasing the money for program management is going to help, dole out these two important programs. One is a former health educator. A lot of the programs that focus on sexual risk avoidance, teen pregnancy, I think that they do best when they are managed on a state basis in a very localized, community focused approach. And I think that if this allows for those programs to be run more, I guess, community minded, and, with more awareness of who is in the room, that is a good thing. Now, if that money is being removed and it allows less young people to get this education, then that's a problem. But if it allows for better connections to perhaps consultants or individual programs that do this sort of culturally competent sex education, then that is a good thing. And so I would say that HHS should work to partner more with these vendors and these consultants to provide these services in, again, a more culturally competent, up to date manner. I agree with this budget adjustment. I think that Indigenous and tribal communities have been severely neglected across administrations, as these communities experience, increasing amounts of pollution and underinvestment historically. And so this attention is needed. However, other parts of the proposed budget reduced funds for programs dedicated to tribal and indigenous communities across public safety, across education, and then even across business development. So it seems a bit contrary to support the built environment, but not the other sorts of infrastructure. Not surprisingly, I highlighted this section. I first of all, I think that the administration needs to understand what environmental justice is. I don't think that they have a clear grasp of what it is. And I think that if they get that understanding with that clarity, then they will understand why it is so necessary to begin, really just begin for some communities to undo decades of environmental harm on Black, Indigenous, and BIPOC communities and other marginalized communities. As someone who participated in the um, National Minority Supplier Development Council Emerging Young Entrepreneurs Program in 2024, and they are a partner of the Minority Business Development Agency, MBDA. I can personally attest the importance of programs that are supported by the MBDA. I, as a business owner, I feel more confident in my knowledge. I have more knowledge about many aspects of entrepreneurship than I did previously. while CFHJ was, not incorporated until 2022. Um, and I have a new community of business owners like myself, which is so important for sustainability as a business owner. So, I can completely attest to the importance of programs that are offered through economic development administrations, as well as the MBDA. In terms of the fair housing grants, this is directly from the Housing and Urban Development Agency's website. But fair housing policies and grants for this particular budget item, they do not discriminate against single family neighborhoods. Um, Fair housing laws are designed to prevent discrimination in housing based on protected characteristics such as race, color, religion, sex, familial status, disability, and national origin. So, while there are some narrow exemptions to the Fair Housing Act, they primarily address situations involving owner occupied buildings with no more than 4 units, single family homes sold or rented by the owner without an agent, and housing operated by religious organizations or private clubs. So there are some instances, but to kind of blanketly say that these grants are advocating against single family neighborhoods is not accurate. And these housing grants and opportunities are incredibly important for um, building intergenerational wealth. I highlighted these because these are the programs that I mentioned that were being reduced, while other programs focused on the indigenous and tribal communities were getting more funding. There are other programs that are getting reduced funding. So I just thought that was an inconsistency. Firstly, I think describing agriculture programs that center history, as specifically Black history, as woke DEI is problematic. Now, however, this budget item does say that it will increase funding for HBCUs and other affinity communities, but only time will tell. I do think that that's a pretty significant decrease in the budget for these programs. And again, agriculture is another important, I guess, sector for building generational wealth, um, especially in the Black community. I think of Tuskegee University and the way that education through that school has helped so many Black students and Black families. So um, it's a little, without better way to explain it, it's problematic to describe anything regarding, I think, agriculture and Black history as woke and as DEI, specifically when it's so tied to our history as African Americans. This budget item says that no new USDA funding is needed for broadband expansion as existing balances and other federal resources are meeting planned growth. I think only time will tell. There are recent reports you can search online within the past few months, even from states like West Virginia, Minnesota, and Pennsylvania, that said that broadband programs have already stalled due to multiple logistic reasons. And so reducing, or I guess stopping funding for broadband is most likely not what rural communities need in order to meet the digital divide. CFI stand for Community Development Financial Institutions. And this is kind of another one along the lines of the Civil Rights Act. There's a note that says that past awards have been made or have made race a determinant of access to loan programs. However, CDFI fund discretionary awards do not make race a determinant to access loan programs. While the program may positively benefit a large proportion of individuals in a community, it must maintain compliance with the Civil Rights Act of 1964, according to the program's compliance reporting. Do you agree very much that medical care for veterans should get increased funding? Even though the Veterans Health Administration has a steady budget, a 2020 report by Public Citizen found that approximately 1.5 million veterans are uninsured, representing about 6% of the veteran population, even though over 9 million receive health care through the Veterans Health Administration. So sometimes access does not always correlate with something being available. And then in terms of EHRs, I remember learning about EHRs in grad school, and I remember the hype around Epic at Northwestern almost a decade ago. Yeah, almost a decade ago. So I think Northwestern and its associated healthcare systems and hospitals have a very developed system for EHRs, electronic health records. Um, but that is certainly not the case everywhere. And a 2021 report by ONC found that 96% of hospitals use some form of EHRs. There's still 4% who are still using paper and pen for medical record keeping, and that's most likely in rural settings. So that's another great investment for rural communities. Lastly, here, I was sad to see these cuts to small agencies, and these are eliminations, so they're gone. But AmeriCorps specifically, AmeriCorps is such an important program. I personally did not participate in AmeriCorps, but I know many people who did, and it's a deeply important linkage for young people and recent grads to jobs in public service. They also have a branch for people interested in pursuing health careers. And so to cut this program in its entirety is a significant loss. Similar can be said about cutting the 400 Years of African American History Commission. And if I scroll down here, the National Endowment for the Arts and the National Endowment for the Humanities. This is much less about money and it's more about whitewashing history and removing culture. If you appreciated this rundown, please reach out to Communicate for Health Justice at info@cfhj.org.